chat function on your screen. Feel free to contribute at any point. You don't have to wait, and we'll be monitoring the submissions as we go, and we'll address as many questions as possible during the Q&A towards the end. If we don't get to your question, or if you'd like to revisit any part of the discussion, a recording of the webinar will be shared afterwards for on-demand viewing at your leisure. Today's webinar is titled Safety Starts Early, Drug Use Prevention and Violence Prevention as Public Security Investments. In the next hour, we'll explore how early evidence-based drug use prevention, especially that focused on children and adolescents, can serve as a powerful investment in public safety and security. We'll be drawing on the international standards on drug use prevention and the European prevention curriculum, and on global evidence on ending violence against children. We'll examine how strengthening protective factors and reducing risk across developmental stages can prevent substance use, reduce exposure to violence, and limit vulnerabilities that criminal groups can exploit. This session is designed for all of us: prevention, drug treatment professionals, public and behavioral health practitioners, policymakers, government. Everybody's welcome, including researchers, students, and folks working across the spectrum of intervention. By the end, we hope you'll be able to clearly frame prevention as a dual investment in public health and public safety, and hopefully articulate the economic and social returns of early interventions. You'll gain a stronger understanding of the intersections between substance use prevention, violence prevention, and child vulnerability. And you'll be introduced, we hope, to some practical approaches that you can actually put in place for translating this prevention science into policy and program design. And most importantly, we hope that you leave with the concrete arguments and strategies for advocating for stronger cross-sectional prevention systems, especially in this global context where security-focused responses have a risk of overshadowing the critical elements of investment in early prevention. We're really excited to welcome our three distinguished speakers today. I'll introduce each speaker just before they speak. Our first speaker is going to be Dr. Wadi Malouf, a good friend of mine, Chief of Prevention, Treatment and Rehabilitation Section at the United Nations Office on Drug and Crime. Dr. Malouf leads a global efforts to advance evidence-based prevention, treatment, and recovery systems aligned with international standards. With a background in public health and psychiatry, he supports countries in strengthening drug demand reduction policies and positioning prevention as a cornerstone for healthier and more resilient societies. Wadi, over to you to get us started. Super excited to hear your talk.
Thank you very much. Thank you very much, Goodman. Apologies, I was having a bit of a trouble unmuting myself. Just to say that Chief is a very generous title to give me, just leading the team on prevention and the Global Prevention Program. And it is in that context that I would have to start by sincerely appreciating ISAP for opening this opportunity for UNODC to share this topic with a group of friends and colleagues and panelists as well, and then also with a group of professionals through the ISAP network to discuss really in terms of our latest advances when it comes to the plea and the advocacy and the actual groundwork we're doing in the field of drug prevention and how it associates with the global context that we unfortunately are all living in, but how also from a positive perspective can contribute positively to help in this context. So let me just start by saying that probably including on several platforms of ISAP, we have presented this, but it's a very important context to start with, where we have our international standards on drug use prevention that describe how prevention should be done in terms of what works and what does not work. But most essentially, it describes the general framework of vulnerability that needs to be addressed in any prevention intervention in order to be effective to prevent drug use. And this is a framework that kind of describes a policy making and a response that dissociates itself from the drug or the substance and focuses more on the person and the context around that person. The person, the characteristic, genetic susceptibility, the mental health traits, how much the person is aggressive, attentive, the person, his or her reactivity to stress, neurological development, who that person is defined under their skin, and the context that person lives in, from the family, the school, the peers around that person, and these structures that are discussed, where are they in terms of what context? Caregiving, parenting a child or an adolescent requires skills, but caregiving and parenting a child in a context of where there is conflict and displacement requires different skills. So these will carry, and the conflict and displacement carries an effect on the person and their character, and on the individual and their own characteristics, but also on the structures supporting this person. So this is a completely different way of seeing drug use prevention, from a person-centered approach that really have to help that person. And that same perspective also reflects the fact that this person-centered approach that is not anchored on the drug, but at the person and the environment around that person, when we're helping in that perspective, we're not only helping vulnerabilities that are linked to drug use, but these are linked to things that are going beyond drug use. They're common for violence, for crime, for school delinquencies, for mental health, and beyond. So the other message for the standard is that if it is a person-centered approach, it means that we can work in any age of development, not only at the age when drug use is initiated, to have this evidence availed to these people that needs these social and emotional skills with their person and their context in mind, but also every single age of development, starting as early as the child is born or around perinatally when the child is born. Every age of development can benefit from different programs that help that person move from the context they are in to another age of development where different milestones of development needs to be attained in order to have a healthy and safe development. I will not go into details for the sake of time, but from the perspective of the ecological model that surrounds violence prevention, pretty much the ecological model has a lot of intersection from a prevention perspective, addressing individual factors, family relationships, school, community, society. So all of these things carry an influence, and the work from a violence prevention perspective has a lot of commonalities in terms of the approach moving forward. So the lens is the same, the outcomes might be different. So with that being said, this is talking about the theory, but also from a practical perspective, when you see the people working in different domains of work and looking at the science that kind of generates, at least from a correlational perspective, and between several factors and outcomes that are of interest in the context we are in currently now. For example, this is from Southeast Asia. We have the UNODC trafficking report on trafficking in border communities from 2023, talk about illicit trafficking in general in terms of different goods, including drugs and beyond. Where you see that there is a very big correlation between youth involvement in crime and where they have a high level of unemployment, school dropouts, and lack of prevention of information. And when it comes to, for example, statistics, data coming from outside the UNODC, from France, where they have the limits framework, where they talk about prevention of narco trafficking, especially among minors being implicated in this, where you see community pressure, quick money, all of these, the equation of risk for adolescent boys to be engaged in such behavior or recruited for such behavior come from disadvantaged neighborhood, as well as the ecological system that we're talking about, and the vulnerability that exists at the individual level. For example, school failures, and beyond. The UK, the same thing when it comes to drug networks, and exploiting people via different conduct, which is like, trauma and mental health is linked to criminal. So the theory of the linkages also between the different domains of work that we're talking about, maybe at the drug prevention, maybe at the violence prevention, or at crime prevention perspective, from a social perspective, carry a lot of similarities when it comes to what we need to invest in. Now, coming to the context we are now, of course, we know planet Earth has I think that it should be the largest youth population that ever lived on planet Earth. And that youth population, these children, these adolescents, and these youth are living in a context of vulnerability that is not similar to any other generation of youth that have lived on Earth. I mean, they have similar issues, but there are vulnerabilities that goes beyond the usual issues that other generations have faced, maybe climate change, additional crises from economic crises, information and misinformation, and a lot of kind of a digital social network that exist, communities that are virtuals. All of these things are vulnerabilities that that the youth are exposed to. But I would focus more on the large population of youth, that are living in a context of stress, of conflicts that are unfortunately raising in numbers globally. And if we reflect on the theory that we have and how youth in such context would have higher level of displacement and instabilities, and how this would carry an effect on loss of structure, this lack of uncertainty about the future, this constant movement, the trauma and the emotional distress, the violence, the bereavement, the stress, and other mental health issues that they're facing, the social disconnection and isolation that they're facing in terms of the family support, the peer networks, the community norms, economic hardships, survival pressures, limited access to services and protection in many places, especially, generally when a crisis situation, especially in situations where we're concerned that, investment are going in a different direction than social work. And increased exposure to exploitation whenever there's a high level of conflict as well. This becomes also, unfortunately, a kind of a catching ground for criminal network and traffickers to be implicated. Identity struggles, all of these theoretical structure that we have in terms of the standards of work that we do across the different mandates that we have that are linked to safety and security exist, unfortunately, in an amplified version, and children and adolescents and youth are exposed to it in a higher number than previous generations. These, as I said, are structural frameworks that we have. I'm coming in and describing it from a perception of the international standards on drug use prevention. But if you look at the strategies that are put with regard to, for example, ending violence against children through the INSPIRE initiative, you see a lot of similarities of areas of where prevention should be placed in order to end violence against children. For example, in terms of the framework, in terms of youth engagement in violence and where areas of investment should be, you see a lot of similarities. Preventing and promoting adolescent mental health, also through the Helping Adolescent Therapy, you see a lot of similarities. So it is a common denominator. But that was the theory. Have we put this theory into practice to see if this prevention can actually help diverse context where youth and children and adolescents could benefit beyond their specific domains? Well, in areas of crisis and especially displacement, we know that family and parenting, that social institution, which is the family, is most of the time the most functional family, despite the fact that it's severely challenged. But compared to any other structure, when we have displacement and war, that's the social institution that you have around children and adolescents that is most needed, let's say, even despite the fact that it's very challenged and it's most available. But they need specific skills. And that's why our drug use prevention really kind of moved from a family perspective to focus on such families. And we had several programs from, of course, when you have displacement, you don't always have the time to have the luxury of doing interactive discussions with the families, where this is where competencies and skills are developed. But we had a program called Strong Families that is brief, interactive, but we also needed to have briefer information, for example, leaflets that the parents can take on the move in terms of things to consider, or small booklets that could be conversation groups that don't require any training where related to parents in terms of how to deal with your own situation as a parent and how to deal with the situation of children, what to see, what to look for, how to help in that context, were also distributed on a very large scale in diverse places that are either facing conflict or displacement, or actually there were lots of natural disasters. COVID-19, for example, was one of them, where we're parenting on the stress, but also earthquakes, floods. Unfortunately, we had many instances since 2019 that go beyond just war and conflict. And on the upper end of this spectrum, also you see the group of parents that face trauma in these circumstances and how adding a parenting component could help with them. Throughout this pyramid, we have found, we know none of these programs, by the way, all of them are aligned with the standards on drug use prevention. None of these programs discuss drugs, but all of them were evaluated in the context wherever they were implemented to check how much they were helping families address leading to a positive change in the strength and difficulty through the SDQ, for example, which is a scale that we use, the strength and difficulty they face with their children, as well as how much parenting and family adjustment is changing because of these diverse versions of brief intervention. And throughout, we've seen a lot of help. I will not have time to go through all the fields where we have implemented, but this is just a demonstrative slide on when we work in Afghanistan, Afghans in Afghanistan, as well as Afghans that were in reception centers in Serbia, where we have implemented strong families. And we, against the SDQ, which is a standardized scale that showcases where kids are on a rating from their parents from 0 to 40 as a total scale, noting that you see there's a gradient that is normalized. Children that are rated between 20 and 40 are considered very high, which is clinically significant level of difficulties. And not surprisingly, unfortunately, the mean of the score of these children was there, either high or very high. Actually, was very high at time 1 before the intervention. But we were very fortunate to see that even with this brief intervention, which is literally 3 sessions, right, of 5 hours, we managed after the session to move the children, the rating of the same parents on the same children, to a more closer to average perspective. So that theory that is put to practice could have, as brief as it is, a very important advantage both on changing parenting perspective, supporting that structure around the children, and the children immediately benefiting and reaping its value within a short period of time. So we have had a lot of Global South publication in different domains of work. This is just a brief view of them in terms of where we have implemented. But aside the fact that we are an office that has the advantage of having several field offices where we can, with our between our headquarter desk and our field offices, translate that knowledge on the ground, we also have the advantage of being in the office on drugs and crime. And I have colleagues like Diane and the team that she represents on the crime perspective, maybe on the violence against women, violence against children, and crime prevention, where we have tried to see how our tools can cross-benefit. And most recently, our collaboration has been in terms of how strong families, for example, can be embedded in our programming in Iraq for the prevention of recruitment of children through violent extremism group under their STRIVE program. I'm sure Diane will give it a better context. But this is where the importance of coming together from a prevention perspective to put our tools that are person-centered for a larger context of development, particularly in the context that we are in, and actually it works. And all of the tools, all the demonstrations that I'm showing you there reflect maybe on the trauma side, on the brief leaflets and booklets that we have had the chance to evaluate in the context, like in Ukraine. These are upcoming publications that you will see soon. My colleague Karen is coordinating this. You will see how even something as brief as leaflet and booklets could make a change in the work. Recognizing also my colleague Ala, who designed these tools, and you see her name repeatedly, Ala Al-Khani. So, yes, I'm sorry, there was a background thing. Yes, individual prevention interventions work, but in the context of work, it's very important that we talk about development, different ages of development, different contexts of development, different individual characteristics, different environment to be take place. There is no way that one institution can deal with the development of a child across the ages of response. And this is where we're working in terms of demonstrating how systems of prevention can actually make a child, when it is child and adolescent centered moving forward. And this is where we have several models that we're applying in different places around the world. We have 10 volunteer countries now that showcase this work, and to the QR code you can see more about this programming, showcasing how systems at scale, when you get multi-sectoral services, many institutions coming together around the common agenda aligned with science, orienting their services, capitalizing on their services, aligning them to the standards, the software, if you like, and the hardware, which is how much coordination there is, how much tools, like including the tools that our colleague in EUDA are doing, for example, I'm sure Ruben will talk about it, that kind of reflect on the quality standards. It's not only the program itself, but the quality of the services, how much is improved, can actually make a change in the future that these youth and children and adolescents are facing. So that's it, what I'm going to give in terms of a theoretical and practical framework. But as a take-home message, I just want to leave you with this. The theory is very clear. And actually, even when put in practice, we know that low-cost interventions aligned with science can actually build resilience that, for a person like me, prevent drug use, and that's my main interest, but it kind of helps way beyond prevention of drug use. It's in the context of violence, crime, mental health, and beyond. Now, it's very important in this context of when safety and security of many is becoming a priority of these countries, where there should be no diversion of the attention to the fact that these remain important issues to invest in from a human right perspective, because the right of health and the right of to be access to get what the science is important, but also from a safety and security perspective, these are also important investment that should not be ignored. And it's not one service that's important, it should be multi-sectoral system, and multi-sectoral system that focuses not only when the age of the problem occurs, but as early as possible in the ages of development of children. And it does take a village. We know from a prevention perspective, at least on prevention of drug use, the political interest is there. And I know even from violence against children, there's a very high political interest. But it's our role as professionals in the field to really reinvigorate the importance of investment in prevention in the current context where policymakers are digressing their thinking in terms of other areas that for them are of higher importance. The return of investment remain very high because these are gaps in vulnerability that, if we don't address, could unfortunately be exploited by criminal groups and beyond for profit-making purposes or for recruitment purposes as well, which is by itself a security threat. So it is imperative more than ever and essential to have that lens in mind for a better tomorrow for these children, adolescents, and youth that we are helping. And with that, I'll pass the floor back to you, Goodman.
Wadi, thank you so much. We'll come back with some reflections after all the speakers have had a chance to share their presentation. Next, we'd like to welcome Ms. Diane Ferris. She's a legal officer with UNODC's Children, Women and Communities team in Vienna. With over 13 years of international experience, she works at the intersection of child rights and justice, advising on legal and policy frameworks to prevent violence against children and to support those who are affected by criminal and armed groups. Her focus of work has been on strengthening child-sensitive justice systems and advancing evidence-based prevention and integration. Diane, over to you. Can't wait to hear you. Thank you.
Thank you very much, Goodman, and thank you for the invitation and the honor to be sharing this time with you. And thank you for all those looking at and being here in this time to share knowledge and discuss. Thank you for my colleague Wadi, and I will try to broaden a little bit the discussion that he already brought up. So let's start. So what we have noticed is from decades, we have responded to violence against children. We documented, it's prosecuted, reported many times, it's just normalized and ignored. But what we're still learning is how we can prevent it at a scale and systematically. But for that, what we have noticed also is there is the need to have a shift in the lens that we see these issues. Safety starts early, meaning that the most powerful intervention point is not after the child has been harmed, but before the conditions for violence take hold. And this is what I want to discuss today. But for that, I will really, to ground this conversation, we need to go a little bit more what is actually happening. What is the scale of the problem to also have a response that meets and matches the problem. So in 2024, more than 520 million, that means 1 in 5 globally live in areas affected by conflict. That share has more than doubled since the mid-90s, and from 10% to over 20%. This is a system within which violence against children unfolds. It's not exceptional, not isolated, but now it's structural and expanding. In 2024, United Nations verified a record of 41,370 grave violations against children. And this is a 25% increase over 2023. This includes children who were maimed, who were killed, who were recruited, etc. Then also we have 48.8 million children were displaced by the end of 2024. That means nearly 3 times the figure recorded in 2010. Children now represent 46% of all internally displaced persons globally and 41% of all the refugees. It's also sad to say that on any given day, around 250,000 children are in detention facilities. 130 million children remain in child labor. And we also, in the digital environments, we have NACMEC registering the equivalent of 29.2 million separate incidents. That means over 99% of cases related to child sexual abuse material. But what is the economic cost of this violence against children? This is a very underestimated figure, and it goes up to 8% of the global GDP. That means approximately $7 trillion annually. This figure belongs in every finance ministry conversation about the topic because it refers the entire question that we have, which is the cost of inaction actually costs us more. Prevention is the investment with the positive return. And this is something that we need to look a little bit more. But what we have noticed also is 3 key challenges that show why the systems keep failing. So if we have clarity on the cause of inaction, this is documented somehow, why our systems keep producing the same outcomes. Those who have worked inside the systems know the answer somehow, but it's worth to name it. And the first step is also to redesign our system. The first challenge is definitional. In practice, not in law, but in practice, also the Convention of the Rights of the Child clearly defines a child or adolescent, any person under the 18 years old with a specific developmental needs. We continue to see a travel trend of questioning this definition when political, legal, or institutional decisions are made. Children and adolescents are too often perceived as objects or threats rather than right holders. Security-driven responses are imposed where developmental ones are required. Punitive frameworks are applied where protective ones are mandated and much more effective. And this happens even though neuroscience confirmed decades ago the adolescent brain is still forming, particularly in areas governing impulse control, decision-making, planning, risk assessment, and those behaviors that we label as potential criminal, it's just normal behaviors of an adolescent whose brain is developing. We have the science, but our systems are not aligned to that yet. The second challenge that we have seen is the fragmentation of interests, political cycles, institutional mandates, budget lines pulled in different directions. And when they compete with child protection usually loses. What this produces in practice is laws and policies built around adult-centric agendas or social control, rather than around the developmental needs and rights of children. Children's rights are treated as optional or symbolic, but they are not. They are pre-requirements to any serious process of state reform and sustainable development. The third challenge is the absence of systemic thinking. Each sector actor acts within its mandate. Health sees health problem, education sees a school problem, justice sees a legal problem, but no one sees the whole child. And as what it mentioned also, the ecological framework of how the environment is so important for this consideration. The result is isolation, temporary responses that only address symptoms, like, for example, involvement in drugs, exposure to violence, contact with criminal networks, but we don't really get to the root causes. So systems designed this way cannot break cycles. They just process them. These are no permanent features of governance. They are design choices. And we have redesigned that with the MBAC strategy. It was developed in partnership with the SRG MBAC. And this is picture a system where every actor, justice, health, education, social protection, security, communities, operate from a shared understanding on who is a child, who a child is, and what a child needs. Where the first question is not what did this child do, but what happened to this child? And what does the evidence say we should do next? This is how the logic of the MBAC strategy is designed. So what we did here is to place the child, not the crime, not an issue, at the center, and mainstreaming child rights across every intervention pillar. The scientific backbone is essential. So this approach is based on neuroscience and also understanding of the adolescents as a second window of opportunity, heightened responsiveness to the environment. And also, this is something that requires a common effort at every level, individual, at the macro, meso, and individual level. That means it's a shared responsibility of every actor at every level. Programs that align with adolescents' brain development, trauma-informed, community-rooted, and co-designed with children and young people produce better outcomes, better than punitive cycles. And this is already proven in evidence-based. Now I want to show you how the strategy works. It works in 3 pillars. Prevention, that means acting early before harm or violence consolidates through community, evidence-based family support, like strong families that mentioned by Wadi. Meaningful participation of children and young people. We have, for example, UNODC champions in Nigeria who have made wonderful change and make a transformation bottom up. Response required trauma-informed and sensitive systems. Focus on repair and healing, not punishment. This recognizes that the children in contact with the justice system are, in most of the cases, children who have experienced violence, and also those before who enter in contact with the law. These 3 objectives reach across 4 priority contexts that it has. So we have the environments where violence concentrates, contexts of insecurity and conflict, where protective structures usually collapse. Justice system, where children appear as victims, witnesses, and accused of infringed criminal law without a specialized response. Digital environments where children face violence, exploitation, abuse, and harm and scale and speak that our regulatory frameworks have not yet matched and still need to move forward. And children on the move, that means those who are displaced, migrant, stateless, among the most exposed and least visible to the protection systems. So around this, we have 5 pillars of action. So we have research and data to close the evidence gap and also inform policy and law. Public awareness to achieve the narratives that enable violence to persist questions. Policy advocacy to actually have communication, like a strategic communication to really promote advance in practice and of the policy. We also have a normative review to align this with international law and standards and norms, and technical assistance. We partner with member states upon their request to really have and overcome the challenges that they have on how they see it and how they address violence against children. I want to bring an example to show how this has been transformed into reality. So Brazil is very inspiring in that sense. When Brazilian authorities learn about the approach of the EUPC strategy and the work that we have been doing under different projects, included Strength Juvenile, they recognize that it's thinking outside the box, but also it allows them to design their own national strategy, inspiring this one. They engage with multiple ministries. They bring them all together. They also bring different community actors, young people. And in April 2025, the Ministry of Justice and Public Security launched the Growing Up in Peace, which is a strategy inspired in the EUPC. Something to highlight about this process is not the resources, even though the allocation is quite high, 82 million in Brazilian currency. But what distinguishes that is that the government acknowledged that children and adolescents involved with crime, violence, and drug trafficking are not criminals or threats. They're persons in situations of vulnerability, shaped by structural violence, poverty, racial inequality, and the systemic absence of opportunity. So acting on this, rather than in punitive, it makes the difference. And the strategy was built through co-creation, multiple federal ministries, civil society, UNODC youth ambassadors, that also allowed to work in the four priority context. As I mentioned, it's just a reflection of the strategy. But what does look like for you to understand better? Justice Ministry treats school retention as a protection intervention. The social protection system counts for reintegration as a security outcome. Digital safety framework treats platform accountability and age verification as a child protection measure. A whole society of government stops violence and starts preventing. What this makes possible? So this makes possible that children remain in school rather than entering systems of violence and harm. Adolescents develop within communities that hold them, and no institutions that could punish and make rather more harm and create more perpetuating cycles of violence and generational violence as well, and trauma. We also have justice becomes restorative instead of cyclical, and these costs actually can be reduced. The resources invested in children are not an expenditure, they are public security framework for the next generation. I just want to leave 3 takeaways and how we can frame it. So to tackle these failures that we have seen across all the sectors, we really need to use three elements that can help us. Harnessing adolescent brain science or brain science to drive positive and social and political change. Promoting achieving how we understand and engage with children and adolescents across all the sectors, and fostering innovative multi-sectoral collaboration and interventions to better protect and serve children. Thank you, it's a pleasure, and over to you, Goodman.
Diane, thank you so much. And once again, I'll do all the reflections at the end, but thank you for just framing us and anchoring us back in the science and also in that relational component and really stressing the importance of multi-component interventions. Looking forward to some of the discussion afterwards. Finally, we have Dr. Ruben Kano. He's a scientific analyst at the European Union's Drug Agency, and he's got a PhD in clinical psychology and neuroscience. He's focused on substance use prevention and broader health and social responses to drug-related challenges. He brings over a decade of experience across research, policy, and practice, contributing to evidence-based, data-driven approaches that support more effective and people-centered response to substance use. Ruben, very excited to hear your talk. Over to you.
Thank you very much. It's a pleasure to be here with all of you and being in this webinar with this very interesting topic. So Today, hopefully, you are still online. We have almost 1 hour, so let's go with the presentation. Here we go. Now, what I want to introduce today is the EUDA, which is the agency what I'm working on, because we have been developed from the last 2 years almost from a monitoring observatory to an European agency. In this sense, the agency has a clear mission where it's monitoring drug trends, alert on emerging threats, share a science-based knowledge, and learn from people and society to develop robust responses. In this sense, the values that drive our work is scientific excellence, integrity and impartiality, customer focus and service orientation, efficiency and sustainability, and of course, human rights and inclusivity. In this agency, I work in the health and social response sector, where we are not just only focusing prevention, but we address other areas of drug intervention, like treatment, harm reduction, social reintegration, by creating training and building capacity, implementation and support the different implementation, international cooperation, and monitoring. In particular, what we do at some aspect or some areas that we do at prevention, focus in this best practice portal, which is the big one menu that we have with different aspects for or areas for prevention. In particular, I'm going to introduce some of them, like the evidence-based database, which is a database that focuses in different studies related with drug, not only in prevention, but with treatment, harm reduction, and social reintegration. And in particular, we have also a specific registry that we compile in a database. It's called Exchange. This is in particular for prevention intervention that have been tested in Europe. We develop a registry where we have 6 levels of evaluation from beneficial to possible harmful. Here is the sample where you can trim and select and filter the different areas. Like, for example, here we filter into crime and what is beneficial in this case, and likely to be beneficial, the other ones. I'm going to present some of them later. Other important area that we carry on at the agency on prevention is the training. We have different areas where we work in webinars, which are not only specific in prevention, but also include other areas of drugs. We have a dedicated YouTube channel that you can also look at this. We have 2 schools, one online, usually in winter, another in summer here in Lisbon, where we are work in a couple of weeks, different areas of topics or works. Recently, we have one is social media and the relationship in the drug use environment, and our program in training, which is the EUPC, it's the European Prevention Program, which is based in particular to provide decision maker and opinion leaders and policymaker with practical expertise and knowledge to support and carry out effective evidence-based prevention measures across different levels of society. This program is aligned with European drug strategy and the EUDA's mission, and we are experiencing now increased demand from different countries, not only in Europe, but also in other international networks that we have, and we are going to broaden the scope of this. In particular, the training program covers different topics, going for the different areas of prevention, focusing epidemiology, the language of prevention, evidence-based approaches in prevention, the international standards and the European drug prevention quality standards, School, workplace, family-based, monitoring, evaluation, media campaign, advocacy, and for the future, we are going to include a dedicated area for crime prevention and health promotion. Some key figures of this program is have been implemented in different people from different countries have been take especially the basic course. We had basic and advanced courses. Right now we have achieved we're achieving because it's going to start currently starting the 9th advanced training cohort. Participants represent more than 65 countries, and we have different experts from prevention, public health, policy, education, research, and we accredited more than 100 trainers that can provide different level of courses in their countries. Sorry about that. So let's talk a little bit more in detail what we know a little bit on crime prevention. This is what it presented. This is some matrix of the risk factors that can be addressed to evaluate, but also design preventions, and taking into account these risks, since we developed that from drug use, but also other outcomes, risk outcome like prevention, crime, violence. A question that surged is what specifically science says about the risk and protective factor for youth crime. A recent meta-analysis published that comprised an umbrella meta-analysis with systematic reviews and meta-analysis for young people below the 25 years old with the outcome variable as crime that they define as behaviors that violate the legal status and are subject to penalization by the judicial system. They found 11 strong factors and 5 domains. In particular, individual and family domains are the ones who explain the most a level of evidence in the impact of crime in young prevention. As you can see there, low moral development, substance use, mental health problem, previous history of crime, and adverse childhood experiences. And in relation to family, we can we see there the poor attachment, poor parental supervision, matrimonial, and neglect. The other 3 domains are social, school, and a domain that they define as victim, where the victim one was the weakest one because the studies has a lower, let's say, scientific impact, lower sample size and other limitation. But here, the school bullying is the one who stand the most for the strong evidence in the impact on crime in youth. But now we had this question: what could we do to address this risk factor? What we can do is apply evidence-based prevention to tackle youth crime. And as we see in this meta-analysis, it seems that we need to cover different aspects of the individual, where the individual develops: family, school, community. What we have there in terms of scientific areas, so studies. So here, for example, for the family, there are a program that's been evaluated in the change registry. This is called Coping Power, or Ultra Coping Power, the European version. This is an integrated program that aiming to address children with diagnosed disruptive behavior disorder. There's a combination of sessions between parents, around 15 sessions, a child, in groups, almost more than 20 sessions, and those are combined. But what is important on this program is that it's the key aspect of working in different processes of the families to work as a protective factor. In this case, parental skills, stress management, problem solving, and communication and discipline strategies. This program has been rated with the highest rates of beneficial for reducing, in this case, different outcome including substance use, but in this case, also crime in youth adolescents. Another program, or more than a program, a framework that is not included at itself in the AIDS registry, but recently they have been working a meta-analysis and going to do so, is the community that cares. So community that cares used a cycle of organizing a local risk and protective factor and mobilizes stakeholders to implement evidence-based intervention to reduce youth problem behaviors such as substance use or delinquencies and promote healthy development. I'm not going to focus in explaining community that cares, because what I want to focus is in the results of the meta-analysis that recently that we're working on to see how community of cares can be used to reduce crime in youth population. What is very important is that overall, the meta-analysis did not show a statistically significant impact, though it was overall impacting, but not statistically. This is very complicated with these studies to find a statistically significant impact, because it's as many other meta-analyses and many variability across these studies. In this case, community that care is not a single intervention, it's more than a system. So therefore they have more variability depending on the context, in the different results, population. So it's very difficult to have an integration on the evaluation on that. But what is important is this study evaluates the, let's say, effect sizes, right? Which is not statistically significant, but what is the effect size according to the sample size and all the analysis that they did. And they found that around 7 of 100 people in this kind of ratio are reducing crime when they are in this kind of program, which is very important to take into account, since some of them usually are focusing more in universal perspective for prevention, where we can achieve at least 7%, which is quite high when we talk about the universal in that sense. But stronger and more consistent evidence is needed for this kind of studies. And finally, what I'm going to present is the school-based prevention to reduce bullying. This program always have been developed in the US, but also implemented in different countries in Europe with high effectivity on that. Bullying is one of the variables that traditionally had been tried to reduce in the school base, and also is connected with violence and possible crime, and considered for this behavior. This program is quite interesting because as we saw in the different presentation today, the problem is not just individual, it's beyond the individual, and we need to integrate different components. Here is focusing the school, so develop a program for the school level with the youth service, coordination team, and a supervision of this task. They have a dedicated task for the classroom, where they focus on clear rules, regular discussion. At individual work, they work with the bullies and also with the victims. And at the family level, they include the parents in this context. Overall, different studies show that the reduction in bullying perpetration and victimization reduced around 15 to 45% on these different studies. So it's quite considerable to this program to implement it in terms of reducing value. Then I want to finish with some take-home messages, as my colleague included. I think it's very nice to have them to reflect. And first of all, we need to take into account that drug use and violence share common risk factors with this disruptive, what we call disruptive behavior in some areas of science. And what is clear that prevention can address both problems simultaneously, because as when we address drug use and prevention, we don't focus in particular sometimes in drugs, but in what is behind why people are using or interacting more with drugs, right? With different risk factor can be addressed with all these programs. Also, prevention is a public health investment, not just a criminal justice issue. Early action, reduce long-term social and health costs. This is key aspect, and we have shown that also in previous presentation. Effective prevention is multi-level. We cannot address only one part of the system. We need to be ambitious and try to cover different aspects, because this is what we need. Individual, family, school, and community intervention all are needed. And finally, integrated approaches has the greatest impact. Combining drug and crime prevention might lead to better outcomes. This should be continued testing, but we have strong evidence that this is the way to go in reducing all of these difficulties in the youth population. Finally, I would like to thank you, and here you have a QR code that you can subscribe to our newsletter if you want, where you are going to receive all the updates of our sectors, and looking forward to the discussion. Thank you very much.
Thank you so much, Ruben, and to Wadi and to Diane as well for your three incredibly insightful and I think certainly complimentary presentations. So I'll invite all of our speakers to come back on camera for this component of the discussion. So certainly across all your contributions, what's clear and what's consistent is that early evidence-based prevention isn't only a public health priority, but a really crucial investment in public safety. And we've seen already how vulnerability is shaped across individuals, across family, communities, and system levels, and really how strengthening the protective factors through really practical science-based interventions can be significant in reducing and limiting exploitation by criminal networks. What also really comes across for me is the importance of moving beyond fragmented approaches, whether this is through rights-based, trauma-informed systems for children, or integrated prevention strategies, and across both substance use and violence. So there's a need for coordinated multi-sectoral action. And so ultimately the overarching message from these three talks is that prevention works, and that the returns are strong and worth the investment, and that therefore investing early and importantly across systems and sectors is really key to building safer, more resilient societies. So we've got a few questions already. I see a couple more coming in. Please keep them coming. Just to get us started, maybe I can start with you, Wadi. We're experiencing quite a volatile period in our lifetimes at the moment. The question comes to mind in a context of conflict and displacement, and where there's already a strain on systems. What are really the most feasible starting points for implementing prevention interventions?
Well, thank you, Goodman. I mean, in the context of displacement and conflict, there are lots of what we call mental health and psychosocial support tool. There's multiple agencies that have a data bank of all the tools that can be feasibly done in that context of conflict. But from our experience, I mean, at least from my side, the family and parenting skills are very feasible, very reachable. From low-key perspective, as I said, we have leaflets and booklets that were distributed to multiple agencies that were extremely helpful to help diverse contexts, may it be from, tips in terms of to avoid, being the violence against children, and the children themselves, their mental health support. So there are diverse tips and hints that can be done, including up to experiences with more interactive packages. But for a full set, MHPSS toolkits are available for access.
That's great. Thank you, Wadi. I think, Diane, the next question will come to you. You really highlighted a need for us to really focus on a more ecosystem and coordinated approach in your presentation. So, a lot of folks will be listening and saying, well, that's great, the evidence is there. But what are really the practical first steps that you think countries can take to start moving away from these fragmented systems, which continue to really plague us?
Sure. Thank you, Goodman. And thank you for the person who posed the question. So let's just go to the example of Brazil. The first thing is to look at examples, what is happening, how we can change the way that we are approaching the issue and addressing it, bringing together all the actors, all there, including society, civil society, communities, children and youth. This is when this makes the change, when you involve all the actors to have a say in a safe place where participation is real, is meaningful. That means that what they are saying is taken into account and is translated into a policy. That is what happened with the policy growing up in peace. And also it's not just one ministry leading, it's health, it's social welfare, it's human rights, it's security. So all of them have the same and common understanding. And of course, having the same foundations. That is the takeaways that I mentioned. Neuroscience, very important. And of course, I will echo what they say. Like psychosocial mental health is a foundational pillar, not only for those who are the beneficiaries, but also for those who are providing the services. Sometimes we forget that these people also are going through a lot of trauma, insecurity, uncertainty. If we are not giving them a safe place and also tools for them to be resilient, they cannot do a good job with those who are they're working with. And of course, whole society approach is a shared responsibility. I think the message is everyone has something to do here. Over. I hope it covers the question.
Thanks, Dan. The idea of what some might frame as interministerial bodies within government that ensure that programs are actually collaborative and interdepartmental and intersectoral is certainly one way to make sure that everyone is singing from the same hymn book, isn't it? Ruben, a lot of folks will be like, well, that's great that UDA is doing all these great things. It's great that you've presented some evidence from what one might term as the West. So one question, somebody might ask is, how can the tools like the EUPC and like the UDA best practice portal be best utilized by countries outside of Europe? So what do they do with this?
Yes, this is a really good question, and we have been done previously, my colleague, because I recently joined the agency, but we have been explored the development of the EUPC and implemented in different areas. So there are an adaptation to South America. All the program is translated to Spanish and adapted also to Portuguese. And in the European countries, also as we might seem as a whole package of countries, we have different realities, and the UPC is quite spread around with different translation, evaluation, the inner trainers, they adapted to their reality, but following the commonest standards. Recently, from the couple of years in the past, we have been developed the UPC in Middle East, North Africa in some areas. There are interests also for Turkey, Egypt. So we have been also translated to the Ukrainian and have some training there. So UPC came from the North American standard EUPC, and then developing a short version EUPC, and now is from Europe is expanding to all these areas, expanding, and the system is enriching itself, because now the courses that we are implementing, we have different nationalities from all these areas. So it's quite interesting. Regarding to the studies and how the prevention systems are including that's true that almost all science is focusing in Western country, and this is a huge limitation. But here my colleagues have exposed initiatives and research I've done in other contexts. So I think as a scientist and also as a policymaker, we need to be flexible and integrate what has been working and how we can adapt to different realities, because the ultimate goal is to improve people's health and people's life, and then we need to be flexible in that regard.
That's great. Thank you, Ruben. I have a question that was initially framed during Wadi's presentation, but I feel like If anybody else would like to reflect on this after what he responds, I would invite you to do so. Ali from Uganda is a researcher, and he says he does think that low health campaign against drug use amongst youth, mainly in schools, have boosted rates of drug use, which have resulted into mental health illnesses, creating way for violence. So more programs in schools have been created to stabilize the issues. So it's almost like he's saying the intervention has actually caused the issue, and now because of the issue, we need to put more interventions in place. I think before I hand it over to Wadi, Ali, it would be wonderful if you have some publication or data to share with us that sort of demonstrates some of that impact, because it would be something really worthwhile engaging with. Wadi, what's your response?
Thank you, Ruben. I think actually it also reflects on what Ruben has mentioned, in the sense of, science is universal, especially when it's a person-centered approach, right? The application of science might require some cultural adaptation, but where the science comes from as well can be influenced in the sense of there are certain vulnerabilities that probably don't exist in the global south, that we need more research from the global south. Now, that being said, most of the evidence we have is from publications that are reflecting on what works, and there is a publication bias whenever there is certain things that don't work or are actually iatrogenic, which causes risk. We need that sort of insight, because that will help others. And this echoes your message, Goodman. Going back to the awareness raising, yes, I mean, I don't want to dismiss that awareness raising is not important and should be avoided, right? But awareness raising requires science too, right? So there are certain things in awareness raising that could work and certain things that could be iatrogenic. There's a science of persuasion that has to come in information sharing and to convince the audience. And which audience are you talking to? Is it a resolute non-user? Is it a person that is contemplating use? Or is it a person early in the stages of use and you want to dissuade that person to go back to treatment? So yes, wrong prevention, wrong messaging, wrong awareness to the wrong person could cause an iatrogenic effect and actually require a different sort of intervention to kind of resolve the problem. One of them being a wrong awareness message and an unconvincing media message that could be counterproductive. So I really like to commend Ali on this question, because it's important to reflect on it. The worst outcome of prevention is not ineffectiveness, but the worst outcome of non-science-based prevention could be causing a risk and causing a problem. Go back to you.
Thanks, Wadi. Ruben and Dan, would you like to weigh in, or you feel like it's covered?
I would like to it's perfectly covered. I was just to support it even more, because this is a key aspect. It's a key aspect. We need to clearly differentiate what is doing something that we think is prevention, because common sense usually say, okay, if people know the risk, they are going to reduce it, right? But unfortunately, humans are a little bit more complex than that, and unfortunately, because they allow us to tackle different approaches. It is clear by now, different study, different location, that providing information for young people on drug use is not effective to reduce drug use. Indeed, can increase drug use. Usually, it's because they increase the level of normativization. The kids say, oh wow, these people use cannabis, then I will use cannabis, because it seems that everyone uses it. But awareness campaigns and information is also very powerful if they is used, determined, and also with a prevention on the back. Then we can rise the problem and then use the prevention as the backwards. And there are clear meta-analysis, systematic review on that topic. So it's very important that we use what is effective, and then we try to adapt, complement, and test it, because at the end we are improving on that. So very important topic, because this is a key aspect in many places.
Thank you, Dan. Do you want to?
Yes, just to bring it from also a broader perspective, one important thing that we always do when we work with partners and governments is it has to be a clear understanding of the environment that we are, and the solutions need to be tailored to that. So it's not bringing something from abroad to do it. It's understanding what is happening in that particular space. We carry out situation analysis where we bring an understanding of the root causes. I think also one of the issues, besides of course of what Dee and Ruben mentioned, is we're not involving the children and the youth in creating this awareness and raising. So they have a slang that we don't understand. They use a language. They have a different way of understanding this risk. We need to bring them. It's necessary to bring them and listen to them and thinking how they communicate. What is the most impactful messages now? And use the language that they use, of course, based on evidence and with a guidance and with support. But I think it's an element that we're missing there. And thank you.
I think one thing we often say, and which remains true, is that awareness drives are really important, and it's important to use those as low impact, but they are not prevention. That you really have to attach additional evidence-based prevention strategies. So if the interventions at those schools were just telling you this is what will happen if you smoke or if you use this substance, that's probably not sufficient. You really have to anchor that in the evidence base. Dan and Ruben, this question I feel like crosses over between both of you, and this is from Catriona. She's a graduate psychologist. She's interested in how evidence-based interventions can simultaneously prevent substance use and violence, and what sort of approaches are you aware of that have shown the most impact?
Rayan, I will let you speak first because
that was naughty of me. I should have told, but go ahead.
Thank you. I just want to say the expert on abuse prevention is Wadi, but I'm going to talk from violence prevention. And thank you, Katrina, for looking at how we look at things in a more systemic way and not just isolated issue. When we work on prevention of violence in general, you also address factors that could be protective for children. That's, for example, what Wadi mentioned. If we work on parental skills, if we work in communication, if we work on giving the tools of children to communicate, to have reporting lines that are adequate and child-sensitive design for them. If we, for example, in Nigeria, we have empowered youth, that they are the ones who are bringing the bottom-up approach. They're the ones connected with the community. The message really goes there to the people that need it. And it's in the community that the difference comes. That's why it takes a village to raise a child. It takes a village to protect a child from violence. And of course, when we address all these issues, one of the consequences of violence that could be a drug abuse can be reduced. So I think it's just looking at a macro, but of course, Wadi and Ruben can speak a little bit more about the particularities of that topic.
Thanks, Diane. Ruben?
Yes, I would like to underscore that again, that some of the studies, and maybe I can just only share a clear example on that, because if I might, it's just only I want to show to the attendant that is showing my screen, right? This is
Yes.
our exchange registry. This is one of the programs that I include in my presentation. Here you have different aspects of the program, but what is key aspect here is if we see the study, the outcome target of this study, you can see here I selected crime for this presentation. How I told you, this is not just only a pure unique outcome in many studies, because crime, as other behavior outcome, it seems as and substance use in this area for many scientific background, it seems as a disruptive behaviors, right? Like crime, it is. Substance use is something. And here, for example, this study targeted, this group of study, relationship with parents, alcohol use, illicit drug use, smoking, crime, other behavioral outcomes, social behavior. So it's, as you can see, the behavior is a kind of mixturing with many things, and we pick up crime to inform it, but the common risk factor is where we need to address them.
Sounds great. Thank you, Ruben. There's a question from Korea. I'm going to apologize, Kim. I think your first name is going to be too challenging for me, and I don't want to be. I don't want to get hate messages after this. Kim, I'll go with Kim. So Kim from Korea says, as a practitioner, I find newly launched integrated care to be way too top down, and so often squeezing already thin field resources for superficial outcomes rather than genuine investment. So I guess that part I'd like for you to comment on, but then if there's a specific answer to the second part of the question, any of the other two can answer. How did Brazil successfully break down ministerial silos and align competing interests to ensure that there was a real ecosystem investment without just exhausting existing resources? You can start, Wadi.
I mean, to a large extent, I mean, I would start where Diane and Ruben have ended, right? Especially Ruben, when we talk about the person-centered approach, right? Because certain ministry perceive themselves that they are kind of the custodian of a specific outcome. But when you're doing a person-centered approach, especially when it comes to system, you always find these things. You know, who's doing drug prevention? You find usual suspect, 2 or 3 entities working around drug use prevention because their mental frame is like the drug is the issue. Who's dealing with drugs? But when you talk a person-centered approach, you start realizing that the players are much more diverse, governmental, non-governmental, academic, in terms of moving things forward. And you start to realize that our services going beyond those that the usual suspects are providing that could contribute to the agenda of drug use prevention, right? A program that encouraging kids to be in school, a program that is kind of a social program that is, a conditional cash transfer where, you can get your social assistance by your kids being in school. Sometimes are not being mapped at drug prevention packages, kindergarten packages for disadvantaged family to prepare kids to go to school, packages for pregnant women to allow for healthy development of a child in early ages of development. These are lots of programs that exist that contribute to a drug use prevention. So they start realizing this. And the reverse is true. There are many packages that are introduced from a drug prevention angle, that could contribute to improving education, that improve mental health. So basically, when you start changing the framework of thinking of policymakers to see how much other ministries have, or other kind of stakeholders, let's say, could contribute to their agenda, and how much the agenda of the ones holding the reins of drug prevention could contribute to others, you start breaking these silos moving forward to also optimize on the investment that the government is doing on child and adolescent development. This kind of advocacy of policymaker break a lot of silos, and this is where, for example, our Commission on Narcotic Drugs took the prevention standard first was 2013, right? It took to 2022 to have the first resolution to kind of talk about early ages of development in terms of prevention, and 2025 to talk about systems of prevention. It takes time, but that mentality is moving in the very right direction.
That's quite a mini paradigm shift, isn't that what you're saying? Actually, you're already doing some of the prevention work. You're already part of the fight. So why don't you find ways to enhance what you're doing by collaborating with these departments who are doing what they're doing and bring it together. So it's really about creating value in what's already being done. So that's really valuable. Ruben and Dan, do you want to weigh in on that, or shall I move on to the next question? No pressure.
I would like to strengthen that because this is advocacy is key in this aspect, and to add to what he said, I think it's even strategically to put in this case for this presentation, as Diane says, also to put the children in the center. What is I like this question that is not that she said in the presentation. What is a children? It seems a simple question, but it's not. It's many definitions around the world. And if we put children, in this case, health as a common starting issue, everything is going to be, let's say, easier because we are going to break things. And we as professionals working in substance use, we face with a lot of things that is not just only substance use. We in different areas, morality to substance, a lot of things. But if we change the perspective, we are going to literally going forward step by step, as what he said, maybe 5 years, but it's going to be more and more and more. And yes, want to add this. And continue for advocating for that and finding better solution.
Awesome. Diane?
Yeah, maybe I will just go a little bit of the example. Why these approaches start happening in Brazil? Because they realize that it's a need, that the gaps that they're leaving for not coordinating are giving the strategic advantage to criminal criminal groups, for example, in Brazil, right? There's a big issue, right? Comando Vermelho, PPC. So they noticed and they saw that these gaps are giving all the advantages for them to recruit children, to do micro trafficking, to have a drug issues that drug management that is they're becoming outsourced for different parts of the world. So they are coming a machinery inside there. So they realize, okay, first we need together to close that gaps, because if we keep working in one area, these gaps keep growing and there are entry points for them. The second point is this is a developmental crisis. Like if we don't go to the community, if we don't go to the families, if we don't go to the children, what happens? More poverty, more inequality, generational trauma, and less progress for our own people, right? They also realize that the way to stop this is also having protected environments, and the focus for that is not only a top-down approach, but a bottom-up approach where we meet together, where there is a pressure point for also change the mentality and also having critical thinking, access to services, and also create people who can create that environment and demand that also from that. So it needs a revolution from many aspects to get there.
Thanks, Diane. So I have a reflection and a question which might be the easiest of them all from today, and you can probably each rattle off some quick responses to this. Idrissa says, yes, it's true. Effective intersectoral collaboration supports children vulnerability or addresses vulnerability in drug addiction. As an organization, Community Empower and Self-Help, they've effectively collaborated with government ministries. So it's that real holding hands and moving forward together as civil society and as government. What she'd like to know, and this is why I'm saying you can probably rattle this off, is there any special training provided under your groups or that you are aware of to empower individuals who are working in the field of early drug prevention, especially for school-going children? And so she's also added that their organization is based in Sierra Leone and they have a real need there. So what are some of those training capacity building resources? I will start with Dan and then we'll go to Ruben and then go to Wadi.
I will look at the issue broader. Let's look at violence prevention. Violence could be in many forms. So we have also tools in UNODC, and back is available, and you also have manuals, child-friendly. Also, for example, teaching child-friendly rights to children is important to also address this issue. So we have tools there. But if you want more detail, I'm pretty sure Wadi has more very practical and detail into drug prevention. Okay.
Ruben, anything from you?
I think a good starting point is also look at the materials that we have on prevention on the EUPC. That is an open handbook, and that's that we use for the training purposes. And in relation to that, starting from there and see how we can integrate different topics, because it can help to set these outcomes.
Anything from you, Wadi?
From our side, I mean, tools. There are many tools that require training, right? So we don't have a lot of opportunity in training unless it's a project based in a specific country. However, we have lots of tools that do not require any training, and they are available. Particularly when it comes, as I said, leaflets and booklets that can be translated into PowerPoint presentation to be presented with families in terms of parenting skills. They are available in multiple languages online. There are discussion guides for youth to engage in terms of discussion when it comes to prevention policy making under our youth initiative page that are available online. If you go to UNODC prevention, you see a lot of tools that are already available with no training whatsoever. If I understood correctly, the colleague that asked the question is somewhere in East Africa?
Sierra Leone.
Sierra Leone. Okay, so on West Africa. So basically, I will not be aware of all the programming that is happening from our UNODC office there in Sierra Leone, but probably we could also check what specific is happening in the country within UNODC. Maybe she can benefit from a specific project that's there in the country. But in the meantime, there are lots of available tools already at no charge.
Thank you so much.
They require no training.
At no charge. People like that, at no charge. So just to reiterate that. So thank you, Ruben. Yes, thank you. Thank you for Ruben for sending the link. And as Wadi mentioned, you can go to the website and get linked. Otherwise, you can email us at info@ISUP and we'll assist you as far as we can. I want to thank you everybody for joining today's webinar. We've really seen how early evidence-based prevention can play a critical role, not only in reducing substance use, but in also preventing violence and strengthening public safety. Wadi's presentation highlighted how vulnerability prevents or develops across multiple levels, and importantly, how practical science-based interventions can build resilience, protect children, and reduce risks and criminal network exploitation. And Ruben and Diane brought us some practical applications of some of this and demonstrated some of the evidence and where it's been successful. So thank you for that. So as we close, I really hope this session leaves you with a clearer sense of both the urgency and the opportunity, importantly, of investing in prevention, not only as effective and achievable and scalable, but also as essential for providing safety and resilience in society. So thank you for our speakers for all or your contribution and your part in being part of this important conversation. This, everyone, brings us to the end of today's webinar. We really appreciate your time and your participation, and we hope you found it useful, relevant, and thought-provoking. Coach is going to send you a follow-up email in the next 24 to 48 hours. It's going to have a link to the recording of today's webinar, and we really greatly value your feedback. So please take a moment and complete the survey. Tell us how we did. Your input really helps us continue to improve and tailor future events. So on behalf of ISUP, thank you for joining us. We look forward to seeing you in upcoming webinars. Wishing you a wonderful rest of your day. Take care. Bye-bye.
Thank you.
Thank you very much. Have a great day. Bye-bye.
Thank you, and goodbye for all.